Hello, and how are you? Welcome to my session on rights of a palliative care patient. And my name is Winnie Barawa. If you're new here, this is a channel that looks into lectures, lessons, and expert interviews in relation to healthcare. If that is your area of interest, kindly remember to subscribe and click on the notification button so that you can be informed when we post our next video. So in this class, I want to discuss more on the palliative care patient. We understand that this is a patient who is suffering from a terminal illness, and most of the time they're in a state of hopelessness, and most of the time they have negative thoughts on their end of life states or a state whereby they are nearing death. So mostly we may think that they don't have rights, but in reality they have rights and we need to protect them by ensuring that we abide by these provisions of rights which are protected in the Bill of Rights and in the International Human Rights Conventions. So let's see, what are these rights that palliative care patients have? So first of all, first and foremost, palliative care embraces human rights that are recognized in the national and the international human rights conventions or treaties. And together, these general human rights are embodied in what we collectively call the International Bill of Rights. So internationally, we have a collection of rights that contribute to the national levels rights that we call the national constitutions or the constitution documents that protect the citizens in their various countries. So what are the International Bill of Rights? So these are included in what we call the Universal Declaration of Human Rights. This is also included in the International Covenant on Civil and Political Rights. And third, we have the International Covenant on Economic, Social, and Cultural Rights. Together, they embody the International Bill of Rights. And this Bill of Rights, they protect any human being who needs services or who needs to be free or to have freedom and to have rights in access to different services. Let's come down to the National Bill of Rights, focusing on the Kenyan Bill of Rights. And in the Bill of Rights in Kenya, we have it on Chapter 4 of the Constitution of Kenya of 2010. So the following are some of the rights which are determinants of a person's physical and mental health in Kenya, looking at the several articles here, from the first article to the ninth article. So on Article 26, we have the right to life. Article 27 talks about the right to freedom from discrimination. Article 28 talks about human dignity. Article 29D and F discusses the right to freedom from torture, cruel, inhuman, or degrading treatment. And Article 31 talks about right to privacy. Article 35 discusses right to information. Article 40 discusses right to property. Article 43(1) talks about right to health. And Article 46 discusses the consumer rights. Now, if you look at these rights, they're spanning across many things. But in all this, the main common goal is physical and mental health. And they're looking at how can this be diversified to cover palliative care patient? That should be the question. So as a healthcare provider who is looking into taking care of this palliative care patient, you need to remember that these are patients that are also protected by the Constitution, because in Chapter 4, there are several articles that protect them. That despite the knowledge that their prognosis is not good, they have less than 6 months and they are hospitalized, they still have a right to life. We do not have a right to end a patient's life. They still have a right and freedom from discrimination. Do not look down upon them because they have terminal illnesses. Promote the dignity, protect them from torture, ensure that they have a right to privacy, ensure they have a right to the right information, properties are kept safe, right to good health, and even their consumer rights are maintained. So this is what is in the Kenyan Bill of Rights in regards to things or aspects determining physical and mental health. But now this can be broken down to fit exactly what it pertains to palliative care. So let's keep on and see how it can be expounded and cater for the palliative care population. So in the palliative care, there are key components of the right to health that needs to be expounded more on the palliative care patient. Number one, we are told the right to health needs to be available, that this includes availability of palliative care services, availability of pain management, opioids, sufficient health personnel of adequate skill. That as much as we are looking into promoting palliative care, are their rights available enough such that we have provided available palliative care that is having good supply of medication, sufficient well-trained health personnel that are going to take care of this patient. And the other component is on accessibility of the palliative care itself, that palliative care must be physically accessible and affordable from all levels of health facilities. And when you look at this right to access to palliative care, is that it should be number one, affordable, and it should be physically available. You will realize that sometimes when you visit health facilities, they talk about we don't have a specialized palliative specialist here. And so they do not even have a special clinic to cater for palliative care services. And this is where now the policy comes in to protect the community and the public by emphasizing that each county government has to put in place a palliative care center or a palliative care clinic to cater for such cases. And the other aspect or component is acceptable. That means that the palliative care needs to be medically ethical. It should be respectful of people's beliefs and values. It should also be culturally appropriate. They should respect the beliefs and the values of the people that they're serving. It's not just about providing a service, but it's about providing a service that acknowledges the community differences and values in which people are enrooted in. And the last component on the right to health in the palliative context is good quality. The goods and services provided at the healthcare facility should be of good quality. At minimum, at least, to have a skilled medical personnel, to have scientifically approved medication and drugs, to have safe hospital equipment, safe water, and also adequate nutrition. These are key components. So the key things that the palliative care should have to meet the right to health is that it should be available, it should be accessible, it should be acceptable, and it should be of good quality. So with this in place, then we are sure that it can be accessed at affordable price, it is accessible, can be accessed physically, it is acceptable, it respects culture of the people, it's of good quality, that services given are safe, they have qualified personnel, good medications, safe equipment, and supply of safe water. So these are key components that needs to be present for us to say the palliative care rights are well enhanced or provided for. So now bringing it down to the rights of palliative care patient. So the rights of a palliative care patient says that a palliative care patient has a right to, number one, pain relief. It is our duty to ensure that facilities have adequate pain medication that are being provided to the patient at the right time and in the right model. Number two, palliative care patients have a right to symptom control for physical and psychological symptoms. That is their right. Palliative care patient has a right to essential drugs for palliative care. They have a right to spiritual and bereavement care. They have a right to family-centered care, that the care should not just be individualized, but it should incorporate in place family and also friends to bring in the aspect of holistic approach. The patient has a right to care by palliative care professional. Remember the aspect of quality, that these services should have qualified professionals who are adequate and accessible enough at the facilities. The other rights that we talk about is patient has a right to receive home-based care when dying or to die in dignity. This patient has a right to access legal services in a case where the patient needs a legal officer to advise on certain rights in their responsibilities, then that's their right to access that. Patient has a right to treatment of disease and to have treatment withdrawn. That is their right. There is right to information about diagnosis, prognosis, and palliative care services. And this patient, palliative care patient, has a right to name a health proxy for decision making. At a moment where the patient is critically ill and they're not able to make decision on their own, they are allowed to name a proxy who can help in decision making, or a person of sound mind who can assist them in making proper decision. And lastly, it is the right of a palliative patient not to be discriminated against in the provision of care just because of age, gender, national status, or a means of infection. So these are rights that are known to belong to patients who are on palliative care. It's quite broad, but as you can see, it's guided by the international rights that trickle down to the national conventions, that is the national constitutions of the different countries. Like in Kenya, you could see the Bill of Rights, and then we trickle down now to the individual rights for the palliative care patients that are able to be implemented at the facility levels. So thank you for staying to the end. Remember to subscribe if you've not subscribed yet, and comment. Remember to share with your fellow students or community, and give a like to this video. Thank you so much, and see you in our next class.